one way to try to anticipate the evidence of an accumulation of damage independent from clinical and MRI activity is to use wearable devices. So if we are able to have a passive monitoring, and I say a passive monitoring because active monitoring, unfortunately, is not something that is very well accepted by patients, at least not well accepted by many patients. There are evidences that after a few weeks of use of this active monitoring, the patient discontinue the study. On the contrary, with the passive monitoring, we can collect a lot of parameters that may, for example, allow us to estimate the walking abilities and also the sleep quality and the some aspect that can be linked to fatigue. And they allow us to have a much more frequent assessment. It's a continuous assessment. So some amnestic aspect can be completely separated. And we may in the future have a new tool that is complementary to the clinical visit, which remain, in my opinion, a fundamental aspect. We should not forget that no one of the technological tools will substitute the face-to-face interaction with the person with the disease. Nevertheless, they can be a very interesting complement about what the patient is telling us. There is, for example, an ongoing study financed by the European community that is claims where this type of combination is tested, and let's see if the results of some preliminary studies like the study Mobilize-D or rather can be confirmed. That means a definite validation of these wearable devices.